Okay, so first categories, advocacy and systemic change. It's too many.
Hello.
My name's Al, and this is Steve. Our presentation today will showcase the process of qualitative analysis and understanding how individuals navigate systems. This was part of a larger project led by Dr. Julia Hardnick and JC Farkas to look at how refugees use disability-related services, barriers, and facilitators to accessing care, and how they think these systems can help. Last semester, members of the team conducted interviews with the refugees and their family members to ask questions about their experiences using disability services. From this, 4 transcripts were created, and this is the one I joined. My first task was to review the transcripts for identifiable information and inaudible sections for clarity. We also picked out themes of the responses to begin the process. These individual documents Steve and I made were made into 2x1 tables where we would copy and paste the entire transcript on the left side and put our proposed codes next to it on the right side of the table, right next to that data. This is done to begin making a code tree of our individual codes and combine them into a unitary code list for further elaboration. So,
I'm Deba. I've been working on this project for going on year 2 now. I'm a refugee myself who has a disability, so this project's been really special to me. And thank you, Elle, for an excellent overview of the project as well as some of our methods. As you can see, we were able to gather data from the community to better serve our population of interest. Through interviews, we gathered feelings and opinions of people who are living with disabilities who also identify as refugees about their experience with access to disability services. Our research project is qualitative research. Qualitative research can be helpful when gathering data about community members' feelings about what is important to them surrounding a certain topic. We use semi-structured interview questions to help guide the conversation while still allowing community members to respond to open-ended questions, which invites more elaboration if needed. This format allowed a space for participants to feel empowered to share their perspective, which was helpful when listening to people's stories about their lived experiences. For our project's next steps, we will continue with data analysis. Part of data analysis involves finding codes that emerge from these transcripts. The coding process and continual analysis surrounding the code tree is really important for the validity of the research we're conducting. We will continue to compare and contrast our codes between Elle and I, and until we arrive at a unified code tree, which will reflect the main codes and sub-themes emerging from the data. And to then code the transcripts with the unified code tree for final analysis and interpretation. Some of our next steps includes using these codes and themes we find to write up and publish our findings, hopefully.
So to kind of talk about the preliminary findings in our research and review the transcripts with refugees and their family members, we found prolonged wait times for receiving services and accessing care. One of these transcripts said that she had waited even 7 years before receiving a diagnosis. There were also various issues regarding translation and interpretation services being provided to them. There was the shared experience of interpreters being invited to appointments or meetings who didn't speak the language that was asked for initially. But more often than not, they said that these interpreters would not show up at all to their appointments. There was also a discussion about a communication device for a child with a disability that was provided to him in English, but he couldn't read it, so it wasn't helpful for him. Transportation was also another issue that was discussed, whether it be public or private transportation provided by disability services or health insurance, whether that be the timeliness of it or the cost. But overall, there was a sentiment that the people in the interviews didn't feel heard by the providers, and they didn't have anybody to go to, or felt that there was no one to help them. And as Diva kind of discussed, our next steps will be kind of elaborating on that research we found, hopefully publishing it in the future.
Hello. Hi, my name is Sia Davis. I'm a student intern here at the Sonoran Center, and my focus this semester was exploring the impact of the pre-employment transition services. I'm here to talk about how transformative employment can be for students living with disabilities. These students gain significant benefits from participating in the pre-EDS program. Pre-EDS standing for pre-employment transition services. The group of staff who developed the program is partnered with Arizona's vocational rehabilitation team, who both work with high schools in Arizona to implement the employment program and to develop ways to support these students. The employment program provides students the opportunity to work at sites like Reed Park Zoo, Golf and Stuff, and Ace Hardware. At these sites, students are given tasks to complete by the store manager, such as greeting customers at the zoo, cleaning golf carts at Golf and Stuff, and restocking at Ace Hardware. These tasks help students improve on their job skills while also challenging their adaptability, communication, teamwork, and problem-solving skills. Working on these skills help these students become independent and increases their self-efficacy and self-esteem. While the students are at the sites working, there is one staff member from the student school and the pre-EDS team to oversee how the students are able to take initiative and to complete tasks on their own. The team members are there to provide emotional and performance support while also evaluating the students' level of improvement and independency for each shift. This also keeps record of their progress. The summer work program is essentially the same thing, but the students get interviewed before they get employed. I have been able to watch and participate with the student interviews being conducted for this summer. The pre-assessment allows us to understand the students' feelings about work and see their level of confidence when asked about their past experiences and their strengths and weaknesses. One thing I caught on during the interviews were that majority of the students that I was able to meet with did not know their strengths or claim to not have any. Compared to the students I have spoke with who are currently working at sites, the students who lacked experience also lacked confidence. When speaking with the students who are currently working, who are part of the program, majority of them are able to confidently give me a list of strengths and also include how they have fun working. After speaking with the students, I have talked with their mentors to ask if they have always been this self-sufficient and to see if they have been able to complete the tasks that they are now in the beginning of their program. The mentors have said no for each student and explained how their skills have improved since they have started working with them. One of the most common compliments that the students have received from their mentors is that they have been able to interact with the customers better and have improved on taking initiative when tasks are needed to be done. Through additional research, it is also proven through questionnaire-based surveys that employment for adolescents is a crucial part for healthy development. It fosters a positive outlook on life and motivates personal and professional growth. Satisfying employment is associated with better mental health outcomes, while employment is linked to increased risk of depression and poor mental health. Employment provides a sense of purpose, identity, and belonging. The pre-EDS program focuses on providing opportunities for the high school students with disabilities to develop essential skills for adult life and employment by overcoming challenges and building a strong work ethic. Employment experience during high school is beneficial for the transition to post-school life by leveraging the benefits of early life experiences. Students with disabilities can pursue their goals with confidence and readiness for future opportunities. Thank you.
Hello, my name is Adriana Grijalva. I'm currently a sophomore here at the U of A studying political science with a minor in Spanish. I was a part of the Disability Policy Fellowship for the Sonoran Center this semester and this year. And I was just elected the student body president, and that's why I chose to focus more on advocacy, because that has meant something to me as a student. Since my senior year, I've been advocating for the transition period from students from high school to college. I worked as a CKG ambassador, and with that, I was helping students and realizing that there wasn't a lot of support for students that had a disability and were going to college. I myself have a learning disability, and I found it really hard to come to a university, and I made it my mission to come to a university and show students that it is possible with support. So I'll be talking about understanding the complex needs of students that have diverse learning abilities. So with this, some of the stakeholders that I used throughout this research was students, faculty and staff, community members, strategic partners, parents, admin, and medical professionals. So with this, I wanted to focus on the DRC here at the U of A, and a lot of students stressed that there wasn't a lot of support in the classroom and out the classroom. So I wanted to see what services were already offered here, testing accommodations, the SALT Center for tutoring, and a lot of students said that professors were their hardest struggles with meeting the test accommodations that we offer here at the DRC. So through my research and interviews, I started asking students what they felt we could do better here. And something that I got was the advisors at the DRC. So when you go through the DRC here, you meet with them your freshman year and you get the accommodations. After that, you no longer meet with your advisor unless you ask to meet with them. So some students suggested through this was meeting more with the advisors and that being into their policy. So with this fellowship and this policy, at the end of the semester, I'll be making a policy brief and presenting it to the DRC with recommendations that I got throughout this research. And under the ADA, both public and private colleges and universities are required to provide equal access to post-secondary education, including extracurriculums, activities for students with disabilities. And with my methods, I use interviews, surveys, and research and policies and resources offered at the U of A. So seeing if students were involved in clubs, and a lot of students said that that was what helped them in the classroom, was being a part of other communities and getting support through that. So some sororities and fraternities, clubs, they get tutoring through that or have set time for that. And some of the discussions that came out of this was improving the support advocacy efforts to those using resources at the U of A, recommendations for enhancing the effectiveness of the DRC, advisors meeting once a year with students using the DRC, and engaging more with all the research such as think tank, writing center, and etc. that we have to offer here at the U of A. And something I realized when meeting with students was that it's not just students with disabilities, it's everybody struggling in higher education to get support. And I think a lot of students don't realize that, but if you like learning visually, that's an accommodation. A lot of students don't realize that. So that is something that I kind of put in picture with this when I met with students that do use our services and do have a disability to those that don't, and they learn differently as well. So lastly, just the university's support services can contribute to more inclusive higher education environments nationwide, fostering academic success and equity for all students with diverse learning abilities. We can facilitate more effectiveness, accommodations, and empowering students with disabilities to succeed by addressing issues within the Disability Resource Center and advising support systems here at the U of A. So that was just kind of the research, and I hope that within presenting this policy brief that we'll be able to improve our DRC to students using these resources. So thank you.
Hi, I'm Kylie McNeil. I'm a senior here at the University of Arizona, and I am a student in the Sonoran Center for Excellence in Disabilities certificate program. So my poster is titled Utilizing a Matrix to Evaluate Existing Trauma-Informed Care Curriculums. This poster discusses my experience working towards the development of a new trauma-informed care curriculum with Dr. Lynn Tomasa. Trauma-informed care is a framework that focuses on creating a safe environment and space for potential trauma survivors. It involves adapting care to avoid re-traumatization or secondary trauma. It emphasizes understanding, recognizing, and responding to trauma. It is important for trauma-informed care curriculums to address the needs of the intellectual and developmental disability community, since we know from previous research that individuals with disabilities are vulnerable to facing and experiencing traumas. How do we adapt existing curriculums to address the needs of the IDD community? For my project, I created a matrix to systematically evaluate 5 different curriculums. 4 of these curriculums were kind of more general comprehensive curriculums, and 1 was more IDD specific focused. This was because while during my review of curriculums, I found it difficult to find curriculums that also address disability or even IDD. So that's why I decided to include the 1 IDD specific curriculum just to kind of see some similarities and differences among the more general comprehensive curriculums and the disability specific curriculums. Right. And I created the matrix in an Excel where I input each curriculum and included its content. Content was characterized by what was listed from the table of contents for each curriculum, and then also what was bolded in the headings and subheadings of curriculums. Once all the content topics were listed in Excel, I started color coding topics based on commonality or similarity. And you can see on my poster just a little excerpt of what this color coding process looked like in Excel. As you can see, it could get a little complicated. All right, and then from this color-coded matrix, I created a list of the top 10 topics included in the trauma-informed care curriculums that I was able to review. So here were the top 10 commons that I found in my review: types of trauma and stress, the relationship between trauma and the brain, adverse childhood experiences, resilience, trauma-informed practices, approaches, and principles such as safety and trust, societal and environmental factors of disability, a general overview of trauma, trauma in different populations, cultures, and communities, trauma in staff, providers, and caregivers, and then also trauma across the lifetime, or how this looked throughout development. During my review, there was 2 main broad topics that I found a lot more in the disability-specific curriculum than found in the broad comprehensive curriculums. Unsurprisingly, one of these topics were disability-related content. Out of the 4 general comprehensive curriculums I viewed, there was actually only 1 that briefly mentioned disability. This was very interesting to me since one of the 10 of my common themes was disability in different populations, and communities. So it was just interesting to see that disability wasn't included in this. Another theme that I found a lot more in the disability-specific curriculum was family-related topics. So this included stuff like how family can be involved in the treatment of someone with trauma, or even how trauma is impacted by an individual's trauma. This matrix served as a great way to see different similarities and differences among trauma-informed care curriculums. Topics and gaps identified in this matrix will inform the development of a community needs assessment survey that will help us decide on content for the new trauma-informed care curriculum. This survey will allow the disability community to inform us on what content they feel would be most beneficial to adding to the new curriculum. This was a very important project to me and a great learning experience, and Lynn Tomasa was a great help to me. So thank you.